The House Family and Veterans Committee will come to order. Would the clerk please take attendance?
Chair Schmaltz,
Here.
Representative Wozniak,
Here.
Fox,
Present.
Johnson. Here. Thompson. Here. Pavlo,
Here.
Wolford,
Present.
Young. Here. Burns. Here. Reingens, Song. Present. Madam Chair, you have 10 members present. You have a quorum.
Thank you, Ms. Clerk, and thank you for being here, Brittany. She's our new clerk, so we welcome.
Yes.
We welcome her. Representative Pavlov moves to adopt the minutes of the December 16th meeting without objection, so ordered. Our next order of business is to vote to refer House Bill 4696. Rep. Thompson moves to refer House Bill 4696 to the Committee on Rules, and the clerk will take the roll in a minute. I'm going to read a couple of cards in first. In support of the bill, Adam Stacy, Mackinac Center for Public Policy. In support of the bill, Elizabeth Henderson, Michigan Federation for Children and Families. And now we will take the roll.
Chair Schmaltz,
Yes.
Representative Wozniak,
Yes.
Fox,
Yep.
Johnson.
Yes.
Thompson.
Yes.
Pavlo,
Yes.
Wolford,
Yes.
Young. Yes. Burns.
Yes.
Reingens, Song. Yes. Madam Chair, you have 10 yeas, 0 nays, 0 pass. The motion prevails.
Thank you, Ms. Clerk. The House Bill 4696 is referred to the Committee on Rules. Our next order of business is to vote to report House Bill 4697. Rep. Fox moves to report the bill. Will the clerk please call the roll?
Chair Schmaltz,
Yes.
Representative Wozniak,
Yes.
Fox,
Yep.
Johnson.
Yes.
Thompson,
Yes.
Pavlo,
Yes.
Wolford,
Yes.
Young,
Yes.
Burns,
Yes.
Reingens, Song. Yes. Madam Chair, you have 10 yeas, 0 nays, 0 pass. The motion prevails.
Thank you, Ms. Clerk. The vote has passed, and House Bill 4697 is reported to the floor with recommendation. Our next order of business is to hear testimony on House Bill 5387 from Representative Cam Cavitt.
Ready? All right. Good afternoon, Madam Chair. Thank you for allowing me to testify today. Thank you, members of the committee. I come before you today to talk about my legislation, House Bill 5387, known as the Green Alert Act. Similar to Amber Alert notices, this bill would allow for alerts to be issued when a missing veteran at risk is reported missing by someone familiar with them. According to the U.S. Department of Veterans, an estimated 17 veterans a day are lost to suicide. Several states, including Texas, Wisconsin, Delaware, Iowa, and Tennessee, have adopted green alert systems to locate veterans in crisis. Improving recovery times and saving lives and issuing real-time alerts, a community awareness can be critical in preventing tragedies and ensuring help reaches veterans when they need it most. This legislation has the support of many veterans organizations, including the American Legion Department of Michigan, who you'll be hearing from next. Establishing a green alert system ensures Michigan is continuing to do its part to take care of our veterans and service members once they return home. Thank you again, Madam Chair and committee members, for the opportunity to testify before you today, and I welcome any questions.
Thank you, Representative Cavitt. And we do have a silver alert, obviously, for seniors, and then the amber alert for children.
That's correct.
So this just kind of fills the gap.
It is. It's the Moselle system. They're set up so it's easy to add to. So the infrastructure's already there. We're just adding a green alert to that.
That's great. And how many states have this already, did you say?
Oh, 1, 2, 3, 4, 5. 5 other states.
Okay. Thank you very much. We have a question from Rep. Johnson.
Thank you, Madam Chair. I was the sponsor of the Silver Alert bill, and it doesn't, I clarify if I'm wrong here, but it doesn't cost $1 more than the system we already have.
That's correct.
Correct?
It's the system's already in place. The infrastructure's there. We just have to have the political will to push forward.
It's total agreement. Thank you.
Thank you, Madam Chair. Thank you, Rep, for your testimony today and for bringing this forward. I know you mentioned that this model currently exists in 3 other states, did you say?
5 other
5
states.
other states, thank you.
Yep.
Can you just talk to us about any data that you're aware of from the other states regarding the effectiveness and the usage of this?
I think the American Legion might speak to that testimony after
Okay.
coming up.
Okay, thank you
But
so much.
I can certainly get back with your office with some with some information if needed.
Sure, that'd be
Thanks
great.
for the question.
Thank you, I appreciate it.
Rep. Young?
Thank you, Madam Chair. Just quick question, because we understand how important this is. I'm just wanting to be clear that there's no abuse of the system. How are they validating that the person is indeed a veteran? We know a child, that's easy. We can even tell with a senior, right? But I'm not certain how we can tell with a veteran.
Yeah, he's going to have a full. My next person's going to.
All right,
Maybe he should have went
Representative.
first. I apologize.
No, it's fine.
He's got a lot of the technical information and details for this.
Thank you. No other questions. Thank you, Rep. Cavitt, for
Thank
coming in.
you.
I know you're running from committee to committee, so
Yeah,
we
thank you very much. I appreciate your
appreciate you
time
coming in.
today.
Thank you. Next up, we have Tim Poxon from the American Legion to talk in support of the bill. Welcome back, Tim. It's always good to hear you.
Thank you, Chair Schmaltz and members of this committee for the opportunity to address you. And I will say right up front that I'll wait for your questions at the end because I'm not going to answer them all because I didn't have it in my prepared remarks. The American Legion Department of Michigan supports HB 5387 based on the following reasons. Veteran suicide rates have increased by 52% since 2001. Suicide is the second leading cause of death among veterans under the age of 45. VA reports 17.5 veterans die of suicide every day, but it may be as high as 44. And this is not in there, but I just got this information last night. Women veterans have a 92.4 higher rate of suicide compared to their civilian counterparts. The issue is of not being able to broadcast an alert that a veteran had left a suicide note with his family came to a head a few years ago. The scenario of events without names and dates is as follows. A veteran here in Michigan left a note with his family that he was going to commit suicide by jumping off of a bridge. His family, upon reading the note, contacted the local police agency. The local police agency, upon reading the note, contacted the Michigan State Police to request an alert be sent out to notify the public and other police agencies of a pending attempt to commit suicide. The Michigan State Police advised that the local police agency that this veteran, based on his age, did not fit the criteria for an alert to be sent out, so none was sent out. This veteran did go to a bridge to complete his suicide attempt. However, as destiny would have it, he had parked in a no parking zone, and a deputy sheriff saw his car in that zone. The deputy stopped to see what the issue was and saw the veteran was walking out onto the bridge, towards the bridge, excuse me. And he told him he was parked in a no parking zone. The veteran replied to the deputy, it did not matter, he was going to commit suicide by jumping off the bridge. The deputy was able to convince him not to do so and to come with him for help. The last time I was able to check on this veteran, he was doing well and receiving help. I'm sure that there are a number of other such stories that do not have a good outcome as this one did. It is for this reason the American Legion Department of Michigan supports HB 5387. Veterans have come to call this the Green Alert, a law that will help reduce veteran and active duty members and Michigan National Guard member who is reported missing and having a physical or mental condition. Thank you, Chair Schmaltz and members of this committee for your time today, and with the chair's permission, I will answer any questions that you may have.
Rep. Young?
Thank you, Madam Chair. Yes, I'm still trying to understand how do we know a person is a veteran when that's being reported, and how does law enforcement or who's ever operating this system are able to verify that?
Well, there's several ways. Number one, of course, we have it on our, if a veteran self-identifies, it's on their Michigan driver's license, which they may have taken with them when they're leaving, but most of them have told their families where their DD-214 or their discharge papers are, and that's a way for them the family to verify it. They may have even pictures of the person in uniform, whatever, in a military uniform, whatever it takes, we want to save the veterans' lives. Thank you.
Rep. Burns?
Thank you, Chair. Thank you for your testimony today. Just a repeat of my question to the representative earlier. Can you talk to us about any out-of-state data and process and just how that's been working?
Yeah, they have not made that information available other than to say that it doesn't happen that often. But one veteran is one too many that commit suicide. And if we can do anything in the state of Michigan to help our veterans, I think this bill is well worth it.
Sure, I would agree. Thank you. Appreciate
Thank
it.
you.
Rep. Wolford?
I'm just a little confused. Are the, Chair, is the questions that have been asked, what happens if a non-veteran accidentally slips in under this and has their life saved? Like, yeah.
I'm just trying to get clarity in general, Representative, because we're talking about veterans, so because
I'm
we're
not being
talking-
hostile. I'm just,
Oh,
I'm
yeah,
literally
right.
trying to figure it out.
Yeah, and I'm just generally and you know trying to understand the legislation because I support this. I support this type of legislation, but I'm just wondering when we're because it's a specific group of people. Then we want to I just want to know how do we identify that specific group of people? That was it.
Okay.
And I mean, you're not walking around with V's on your head. I'm not being facetious. I'm just genuinely trying to understand it, not to throw shade on it or anything, but just trying to understand it.
Okay.
Yes, sir.
Thank you
Mr.
for that. I appreciate it.
Yes.
And thank you for being here today. God bless you.
Thank you.
Well, I think, you know, when we have the amber alert for children and the silver alert for seniors, this kind of fills the gap, as I said before, to make sure that our veterans are taken care of. And of course, as you said, we want to do everything we can to prevent anybody, veterans and everyone else, from having a bad outcome here. So, Representative Wozniak?
Thank you, Madam Chair. Thank you for your testimony, Mr. Poxon. On the issue of it being a veteran, is there going to be any confusion on the intake as to he doesn't have to be a senior, but he's a vulnerable adult?
Because of this bill, if it passes, he would not have to be a senior. That's written right into the bill, as I understand it. It's for veterans. And in the case I cited, this guy would have never fit into being a senior. I would, obviously, but he would not. But then again, you have the same thing with seniors. If somebody says, well, my husband is 69 or 75 or whatever the cutoff is for senior alerts, silver alerts, excuse me, how do you prove that he's actually that age? You're going to have to take the word at some point of the person and put that information out. If we save any lives, that's the important thing. But we want to save our veterans because they're more vulnerable to suicide, and we want to cut that down any way we can, cut the numbers down to.
And Rep. Johnson, the silver alert does include vulnerable adults also. So that is covered in that
Yeah.
area.
Right.
But they have to be, I'm sorry, I don't know the exact age that they have to be considered silver. Definitely, like I said, I would be considered silver.
Yeah,
65, okay.
yeah.
Thank you.
My concern is whether or not the intake people are going to be, the 911 people are going to be informed that there's no age requirement on this.
Well, that will be up to the responding agency who responds to the call, because an agency is going to have to, a local agency is going to have to report it to the state police unless it's the state police that respond. So they will have to verify however they can that that is a veteran or that the person is really in danger of some type.
Thank you.
Thank you very much, Tim Poxon, for joining us again. We always love to hear from you, and we appreciate your comments on this bill.
Thank you, Chair.
Representative Johnson moves to excuse absent members. Nobody is absent. That's good. Without objection, so ordered. There being no further business before the committee will stand adjourned. Oops. Excuse me? I didn't drive all the way here for nothing. I thought I was going to have an opportunity to speak. Did you fill a card out? Do you want to give him a card to? Well, we certainly don't want you to. Can you fill out this card for us, please? I apologize. That's okay. This is my first time. That's okay. Saved by the gavel. Thank you, Rep. Rangans, for that. Thank you, Robert Bowl. You would like to testify on House Bill 5387. We certainly respect your time, and we're glad that you showed up here. And don't worry, some of us don't know all the procedures either. So we're
I'm the author of the resolution that went before the American Legion
oh,
a few years ago. It took that long to get this far. But, well, I'm used to talking my head off, so maybe, but I'll sit down.
well, we welcome you, and go ahead
you.
with your testimony.
Thank you. One of the things that I was worried about when I first read about this was that it was being attached as a supplement to the senior alert. And I have a quick story for you. I was working with a veteran out of an apartment building. He was an older man, used to ride on his bicycle every night, took his bike out and went away and come home that evening, and everybody was fine with him. One night he didn't come home. And the apartment complex couldn't call to make anybody aware that he was missing because you have to wait 24 hours before you can file a missing persons report. They found his bicycle the next day, but they never found him. And 2 weeks later, we found him in a hospital. Now, the original bill was written because of a veteran who went missing from his home in Wisconsin. And it took them days to start looking for him, and they found him 18 days later in a ditch. Our veterans are very susceptible to a lot of environmental problems today. Our veterans are young today. I'm an old fart. I'm a Vietnam vet. I've been home from Vietnam for 56 years now, but I still feel the effects. I suffered under Agent Orange. I've had cancer and various other operations. I know what these veterans are going through. But when you talk about things like military sexual trauma, MST, that faces every one of 3 veterans, women in our military, and one of every 8 male veterans. When you talk about traumatic brain injury that can cause a veteran to do things and not be able to do things, and think things and not to be able to think things. And this happens to vets at young ages too. We have veterans that are suffering from these maladies like early onset dementia at 25 years old because of the things they've been through. It's important that this bill is there for our veterans so that we can find them and we can get them the help they need, and we can do it right away. I've been involved with the Amber Alert many times. I have 6 kids of my own. I have 16 grandchildren and 10 great-grandchildren, so I have a big family. So whenever an Amber Alert comes out, I'm aware, and I want, and I rush, and I look, and I think, and I hope, and I pray. I'm also an ordained minister, so I do a lot of praying, and I pray for my veterans every day. But without this, we have less a chance. Now, the VA wants us to know that there's 17 to 18 veterans that die a day. But understand this, too. The veterans only serve in this country about 30 to 35% of the veterans. And in this state, only about 25%. So their statistics are only on those that they know, only on those they work with. The statistics that we have that were quoted by the American Legion are better, more like 40 to 45 a day. And that's those that are reported. Another quick story. The VA, we lost a friend of ours. It'll be 3 years this coming August. At the VA in Ann Arbor, he went to the hospital to get some help, evidently. Came out, got in his car, locked the doors, pulled out a gun, and with all of the police officers around him, shot himself in the head. right there in the parking lot of the VA. And yet, the medical examiner deemed it I can't remember the term now, but it wasn't suicide. Gave it a different name. If they can corrupt that kind of data, then we know that the data we work with is not correct. How many of you are familiar with the pit count? Anybody familiar with the pit count? Okay. The point in time count usually happens every third week, somewhere in January at night, to catch as many people who are homeless as possible, but they only find the ones that are not in a shelter, that are unsheltered. 70% of the homeless women veterans in this country have one or more children. They can't go to shelters. In most cases, they can't. All right? And a new one, I just found out this last winter, we have veterans sleeping in storage units now today, right? Storage units cheap, $60, $80. Close the door, nobody bothers you. But then they're freezing. Okay? There's no reason why in this country we should have a veteran, I'm sorry, sleeping on the streets. There's no reason why. Listen to me, I'm a blubbering idiot.
No.
Yeah.
We appreciate.
And I work in the mental health field of all the things that I do. I'm a member of the Walking with Warriors program. Some of you may know that. The Walking with Warriors. We're involved in helping veterans seek out help and treatment and any other thing that maybe the VA can't provide, among other things. Whether it might be homeless or otherwise. The two greatest factors in this state that we see right now for veterans is homelessness and transportation. And neither one of those can cause us to have problems with losing veterans and not being able to know where they're at. Okay? Please. Please. Thank you.
Thank you very much for your service, and I'm sorry for the health problems that you've had, and I appreciate that
My
you.
health problems, I don't want you, look at, come on. I don't take care of myself, I take care of my vets.
Oh, I appreciate that you've worked on this bill in the past, and I'm sure that we're going to get this through without opposition. And just thank you for all you do for our veterans, again, for your service. And we are trying to work as much as we can to help our veterans in every way, shape, and form. And no, they shouldn't be sleeping on the streets in the cold at all. We're working on homelessness, and we're working on different things to help with mental health. So thank you for all you do. And I love that you came and testified, and
Thank you. I
we're
appreciate
very
your time.
happy. And thank you again for all you do.
God bless, thank you.
There being no further business before the committee will stand adjourned.